Good evening, everyone. Good evening and happy Friday. Thank you for joining us. My name is Daryl Mormilli. I am the Brooklyn chapter representative, Nostalgia Esophageal Cancer Research Foundation. Tonight we will be joined by Billy, who is an esophageal cancer survivor, and he has agreed to join us for the Survivor Series. As many people know, very difficult cancer to fight, very difficult cancer to battle. I joined the Salgy Foundation's mission in 2019, and we have an event every year in honor of those who lost their lives to esophageal cancer. And even though I wanted to have a survivor at the event, I took the next step to reach out to survivors who I met through social media excuse me, to share their stories, to share their fight. So, Billy, I'm so glad that you're going to be joining us to share your story, to share inspiration. And if you'd like to join us, Billy, you can request to join anytime you'd like to introduce yourself to everybody who's watching. Going to bring him on right now. And he was diagnosed in 2017, and he said that he had symptoms in late 2015. So he's going to share his story with us, and he's just going to take us through his experiences and everything he's gone through. Hi, Billy. How are you? Thank you for joining us.
Hello.
Thank you so much for joining us. How are you this evening?
I'm doing great. How are you?
I'm doing great. I just want to say it's an honor to speak to you as a survivor. I'm so glad to be able to share your story and to have you share your story firsthand. So just give us a brief introduction and tell us, as I had mentioned, when you started having the symptoms and how your battle began, more or less.
Well, if we want to get to symptoms, those probably started as early on as late 2015.
Mm-hmm.
I am never a person that ever really had a problem with heartburn, and I started to notice, especially at night and when I was sleeping, I would get interrupted with um, coughing up a little bit of stomach acid, burning throat, um, just things like that. And over the next year, um, more and more symptoms slowly came on. But really, I would say the spring and early summer of 2017 is when I really started to notice that something was I thought seriously wrong. So that's when a lot of symptoms started to manifest themselves. Kind of a dull, throbbing pain right behind the sternum, and that would radiate kind of to the back and shoulders at times.
Mm-hmm.
Um, Let me see here. I've got things written down.
Sure, sure.
So I would say about maybe 10 to 15 pounds of unexplained weight loss,
Wow.
more fatigue than normal. Um, I had perfect teeth until I was probably into my early 30s, and I even had all of my wisdom teeth yet, and even even a couple years before I was diagnosed, you know, the wisdom teeth had to go. I started to need a crown, cavity,
Mm-hmm.
fillings. That's a sign of,
Wow.
or it could be a sign of, really bad acid reflux because
Wow, didn't know that. Wow.
that's an often overlooked thing too, is, if you have perfect teeth your whole life and suddenly they start, going to pot, that's a symptom.
Wow.
Heartburn started to get much, much worse.
Hmm.
Uh,
And when did you seek treatment? Because most people have heartburn. I mean, heartburn. Any normal people who don't even have, precursors for the cancer, they have. Anybody can have heartburn. So what finally, convinced you this is just not this prolonged? sensation, this prolonged discomfort? What finally made you decide this is not normal?
Yeah, so later on in the spring and early on in that summer, that's when I started to notice two areas where food, like when I would swallow, I would feel food hanging up like it didn't want to pass smoothly. Um,
Right.
I knew I knew that that was whatever was wrong there, that was not good. I
Wow.
already, Dr. Google, I kind of
Hmm.
had it in the back of my head, maybe that's what this is. I went to a local clinic um, in the area, and the doctor just kind of said, "Well, you've probably just got heartburn. That's not too uncommon."
Right.
And he basically told me to start taking Prilosec, and if my symptoms didn't get better within 2, 3 weeks, to get in touch with him again. I didn't really like that answer, and
Of course.
surprise, surprise, the pills worked great for the heartburn, but that swallowing problem just kept
Right.
getting worse and worse. I didn't even want to go back to that facility, so I set up an appointment for gastroenterology at Mayo
Good.
Clinic in Rochester.
Hmm.
And I think it was about almost a 2 month wait just to get in there.
Wow.
But
And that kind of backs up the process of you getting the treatment that you need.
it really does, yeah. Now maybe looking back, maybe that other doctor could have possibly referred me, and I might have gotten in a little sooner. I don't know, but um, yeah. So and getting into July and August of that year,
Mm.
things really started to get bad. I mean, I was probably aspirating in my sleep a
Wow.
couple nights. I mean, that's, not only coughing up the acid, but having that stuff run into your lungs.
Right.
And
Right.
that is extremely painful for anybody that's experienced that.
Right.
But
That's
I
another
would,
sign that said it's more serious.
hmm
Yeah.
So like night sweats too. There were times where I get these drenching night sweats when I sleep, and that can be a sign that cancer has already gone deep
Wow.
into the lymph system.
Hmm. So you
Did
started
I?
adding all this all started adding up of symptoms that were just not, you know, not really simply heartburn or acid reflux. But I mean, the swallowing is a big part because my father had the same thing. The acid, he had acid reflux and heartburn for, I would say, well over 5 or 6 years. One day the food just got stuck, just
Hmm.
stuck. And from that moment on, but the way you're saying is absolutely correct. It took multiple doctor visits, waiting months, and just fighting the system. Like you say, if you could have done it differently. So then, what was the next step that you took after you were a little more proactive in light of all the symptoms you had?
Well, the next step really was that first appointment at Mayo.
Mm-hmm.
And the first day there, they really didn't think I had, they didn't really think cancer was a big possibility. You know,
Mm-hmm.
age wasn't a factor. I was a little bit obese, but even they tried to tell me, well, people your age typically don't get this. They said, well, you could possibly have a hernia or
Mm-hmm.
something else causing it, and
Right.
um, you know, they they did schedule a scope right away though.
Mm-hmm.
That's an endoscope where they
Right.
stick a tube and camera down your throat.
Did they
Um,
do a biopsy at that time? Did they do it? I did. I mean, I'm assuming they did a biopsy as well.
yeah, right when that scope went down that next day, they did do a biopsy,
Mm-hmm.
and they, you know, waking up from the scope, I remember talking to the doctor, and all he would tell me was, well, we found two areas of abnormal tissue in your esophagus. We
Mm-hmm.
took some biopsies, and they said we're going to refer you back to gastroenterology, and
Right.
the doctor will go over those results with you tomorrow. Um, I just, but at that point, I just knew the way that doctor looked at me that it was not
Not
good.
good. Did they hadn't
Yeah.
mentioned the C word to you yet?
No, I think he had probably seen this thing probably hundreds of thousands of times before, but
Mm-hmm.
I'm sure I'm sure it's procedure.
Right.
But yeah, so I remember the next day going into gastroenterology again. Now this was day 3 of appointments.
Mm-hmm.
Um, and I remember, you know, the doctor showing me actual pictures of the scope on the screen. First he went into the first part of my small intestine and he said, "Well, everything is normal here. It looks fine." He went into my stomach and he said, "You have a lot of inflammation here. You have a couple of small ulcers." He
Mm-hmm.
said, "We biopsied there and in multiple places." And he said we couldn't find anything abnormal here. And then he got into the esophagus and he showed me these um, the two tumors, and he pointed to them and he said, "These are tumors. This is esophageal adenocarcinoma, and this is a very serious and aggressive type of cancer, and it's very
Wow.
deadly." Yeah.
Oh, that would scare me 100%.
Well, yeah, I
And you
just
don't
kind
even
of
have you had, and this is a question I ask most people, have you had heard of esophageal cancer at any point in your life prior to this? Because I hadn't. I never knew that that was a cancer that the body would be able to produce. I never thought of that.
yeah, I had heard of it. I assumed you could really get cancer anywhere when
Anywhere.
you get, but it's not a very common one.
Right.
So I'm, you know, even when dealing with the whole digestive tract, I mean, I think pancreatic cancer gets a lot more attention, which
Yeah,
obviously
absolutely. I
a little bit
agree.
worse.
Yes.
But you hear a lot about, colon cancer. That seems to be the one that a lot more people seem to get. But
Correct. Well, they
other
can
than
also
other,
detect it sooner because there's mandated screenings. One of the things that they don't do, especially since you were so young, also, there's no mandated screenings if you suffer any of those symptoms. The minute somebody has heartburn for a prolonged amount of time, it's not, we require endoscopy, 6 months in, a year in. I think that's why the other cancers get such, I want to say, such more attention, because even if you're over a certain age, you get a colonoscopy, women get a mammogram. It's
mhm.
it's among the mandated screenings, and that's something that, I mean, it upsets me because so many people suffer from heartburn, acid reflux, and they don't even know, and it's not mandated.
Uh-huh. And you know, so much, not just with um this type of cancer, but anything, the Western medicine seems to be have this mentality of treat the symptom, not the problem. Well,
Correct. I
it's
agree.
not it, it's not normal to have heartburn to begin with.
Right.
Either you're eating something that's causing it, you're allergic to something, or your body has some abnormality that's causing it,
Mhm.
like a hernia or, you know,
Right.
like that.
Mhm. So,
So
what was the process after they gave you the news of what the status of the tumors were? What was their the follow up?
Well, I didn't get my final diagnosis till a week and a half later.
Wow.
The next thing to do was a CT scan, um, and that showed quite a few lymph nodes involved. Yeah, that showed quite a few lymph nodes involved. They picked up what was, likely a third mass, up here in the lower, kind of the lower neck
Mhm.
area, which did turn out to be another mass. And I think it picked up the lymph nodes in my, up by my left clavicle up there. Um, so, uh, you know, essentially, after I got the report back from that, they said it's definitely stage 3 and it's quite possibly stage 4.
Wow, that's
The
scary.
next, I think the next thing I did was called endoscopic ultrasound. That was simply another scope um, where they just kind of map the tumor out with an ultrasound just to see how deep it's penetrated,
Oh, I see.
that
Right.
that picked up, I think, maybe a few more lymph nodes down in that area too that were a little bit enlarged. But the final killer was the first PET scan I did. Um, so that picked up, you know, the 2 tumors in the stomach,
Mm-hmm.
um, the third tumor up here with a couple more lymph nodes around it. Um,
Wow.
the ones in my shoulder that were questionable, I mean, those lit up red hot. And 3 other groups of lymph nodes going basically all the way down to the kidneys.
Mm-hmm.
When they,
Wow.
from what they can tell, it actually stayed out of my organs, but the PET scan, like they actually put it up on a bigger screen to show me. I mean, it looked like some kind of demented Christmas tree.
Wow.
That
That's
that's
crazy.
yeah,
That's
and
scary.
and
It's very
yeah,
scary.
and I think it was August 30th they told me, um, this is definitely stage 4. We can treat you as long as we can, but they said we cannot cure you.
Wow.
hmm
That's, I would say that's harsh, but what was the emotions going through you at that time?
You know, I'll say this. I'm a Christian. I know who my Lord and Savior is. I wasn't really that afraid of dying so much as the suffering that was probably going to be leading up to it.
Mm-hmm. I can understand.
That's that's what really scared me.
Wow. Wow. And when did your treatment begin? Let's just go over I guess the treatment briefly, and then when you decided to have the surgery.
Um, Surgery, I'd rather get to that a little bit later. Surgery didn't happen for another 3 years.
Right.
But the treatment they offered me, they said, you know, you can't, initially they told me you can't do radiation. It's just too wide of a field. It's probably going to do you more harm than good at this point. They
Mm-hmm.
offered me either standard chemotherapy or chemotherapy with an immunotherapy uh, drug, which was a clinical trial. And um, I opted to do the clinical trial. And, um, I if it was possible that the 2 drugs could have worked together and maybe there was some benefit from those, I thought, well, maybe this could be a good thing.
Right.
And the immunotherapy I took it's called Tecentriq. That's very similar to Keytruda that a lot of folks are taking these days.
Mm-hmm. I've heard of that.
Gotten that's gotten a lot of approval for esophageal cancer as well as other cancers.
Mm-hmm. And how were you feeling during the treatment? Did you feel like you were fighting? Did your body feel a little bit stronger, or were you just in a constant state of just kind of going with it?
Um, the treatments themselves, well, they made me feel during those this is what the treatment was. So I would get about 2 to 3 hours of infusions at the clinic, and then I would wear a pump home,
Mm.
you know, 46 hours that would slowly pump more chemotherapy
Wow.
into me. So it was essentially, 2 to 3 days of just feeling icky and yucky, and I did great. I did great with those treatments at first. You know, I like I said, 2 to 3 days of feeling like garbage, and I just sort of snapped right out of it.
Wow.
And they typically hit you with the hardest stuff they can at first. So
Wow.
it was some stuff. Um, Now towards about the I would say about the 10th or 11th treatment, I was getting these every 2 weeks. I started developing a reaction to one of the chemotherapies. Um, Mainly it was high fevers. I'm not sure what was going on, but they had to remove that
Wow.
um, 6 months later. Eventually they have to remove it anyway, but I was getting a pretty significant neuropathy. That's the pins and needles feeling in the hands and feet.
Wow.
Um, but getting back to how I was doing overall, after only 2 treatments, I could swallow food again, no problem.
Oh, wow.
After only two,
That's
and
actually pretty impressive, and I mean, at least be able to eat, because that's a big step to be able to actually eat and ingest.
just yeah, just to be able to get food down was an amazing
Right.
feat. I mean, to get it down without fighting and suffering and getting the hiccups and
Right.
almost
Right.
throwing. Yeah, but so we did the first set of follow-up scans in, I think it was late October of 2017, and it showed just a massive improvement. The tumors in the esophagus were barely visible,
Hmm.
um, and there was only one group of lymph nodes that was still visible, and that was up around this third tumor.
Hmm.
But it just showed massive improvement across the board.
Wow.
And um, my one of my oncologists told me, this isn't too uncommon. A lot of times the cancer builds up a resistance to the chemotherapy or it mutates, so don't expect this miracle result every time you come in.
Wow. Well, that's not being positive, is it?
No, it's really not.
Which is
But
sad. I mean, I would think that they would push for more, just sort of an encouragement that you're and putting your body through this at the same time and to keep going.
yeah, sometimes you need to find your encouragement from other places. You're
Right.
not always get
Absolutely.
it from your doctor.
Right.
But the next set of scans right before New Year's that year, it happened again.
Hmm.
So the only place that was lighting up was this tumor in my upper, or in my lower neck.
Hmm.
Um, Everything else was gone, or not, at least not lighting up anyway. And and I think it was, yeah, scans every roughly 8 weeks or so. But by June, I went into remission. Nothing was visible.
Wow, that's great. I was gonna say that you saw this little bit of a glimmer of hope.
Oh, it was a huge glimmer of hope.
Yeah.
I don't remember who I asked about uh like a survival timeline, like literally how much time do I have left, but I think I
Right.
was told in words at one of my first treatments, you might get 2 years if you respond to treatment. If things go bad, you may only have, maybe 9 months, a year.
It's
Um,
almost like they just give you a timeline of when the end is coming, which I think is discouraging because they don't know the person's body, how your body's going to respond, what your choices are going to be. So it's a little it's still on the discouraging level, if for me.
mhm. I wish they would just say, I don't know, because everybody responds to
Definitely. Right.
treatment differently. Yeah.
Right. Even though the
So,
statistics give most fighters like 5 years, like the 5 year survival rate, and we'd like to kind of crush that myth or theory or projection.
yeah, the survival rate, like the overall survival rate for 5 years, is still pretty terrible.
Right.
The treatments themselves are starting to prolong life a little bit, but it's that 5 years.
Yeah.
Even in some of the lower stages, like recurrences happen quite often, even
Right.
after surgery, and
Mhm.
yeah.
And what ha so how you were feeling pretty good after it went into remission, and what happened following that?
Um, I did the lower dose of chemotherapy. That was just the 5-FU pump and the
Hmm.
immunotherapy. So I did that for another solid year, actually 13 more months.
Wow.
So July of July of 2019, I had done 48 treatments already. Um,
Wow.
and finally, you know, me and my oncology team kind of made the decision to just try the immunotherapy by itself. Hopefully that keeps it gone. Um,
Hmm.
the thing with stage 4 is there's no protocol. If you actually do go into remission, I mean,
Hmm.
sometimes just stop treatment and wait. Sometimes people just choose to do treatment a
Yeah,
little bit.
I almost feel like they don't know enough about this to, to really get it under some type
Mhm.
of, I don't say control, but it's almost like they don't do enough research to know exactly like what you're saying, how to deal with each stage, how to treat each stage. It's as they go, and then they're just going by statistics, which is it's also discouraging.
It is, yeah. And well, the sad part is most people just don't survive stage 4 long enough for them to have a
Correct.
protocol.
Correct.
And
Yeah.
those that do are kind of left in the dark. I mean, my guess was as good as my doctor's as far as what to do. You
Right.
know, they what they recommended was just to keep on hammering at it.
Hmm.
Thing with the clinical trial is if I stopped treatment, there was no getting back onto it.
Mm.
So,
All right.
and basically they said this is what's worked, so we really hate to change what's worked and have it not be a good choice.
Hmm. Right.
Um, so yeah, we're at July of 2019 here, um, almost 2 years already into this, and
Hmm.
um, you know, after getting rid of that chemotherapy, this kind of just became, it already was, but instead of cancer treatment being this massive interruption, it almost turned into sort of a minor inconvenience for me. I
Or
mean,
like
I
a
guess
lifestyle at some point because you're just continuing.
yeah, I had just gotten so used to it. And
Hmm.
with the immunotherapy by itself, I mean, the stuff for me had almost no side effects.
Wow.
It was essentially like water. I mean,
Wow.
it, um,
And what
but
and what led to them? What led to needing the surgery? Because I think it's an important part because most people don't opt for the surgery. It's a big decision to make,
mhm.
depending on how invasive it is. So what had led up to that that moment where that was gonna be an option for you going forward?
Well, later on that fall, I started developing the problems with swallowing food again. Um,
Mm.
it kind of slowly came on like it did before, and I did another scope later that fall. And before I did this, they told me, now, you know, you were stage 4. Now, don't be surprised if we go down there and we find active cancer cells. They said it's very likely. It's just reality.
Hmm.
And they did find a tiny little bump at the bottom of the esophagus. Um, it was cancerous, and they were actually going to try and remove that without the massive surgery.
Hmm.
it's actually a very simple and quick procedure that they can do.
Mm-hmm.
That was going to be the plan. I went in there a month later, you know, that was what we were going to do. And at that point, they found another tumor growing in the top part of my stomach.
Wow.
And they they think it actually it was probably there when they did that other scope, but it was possible that it was growing underneath, like underneath the skin, underneath the stomach lining.
Mm.
So could have been missed, but that was actually causing the swallowing problem this time.
Mm-hmm. Okay.
So yeah, that was pretty devastating to come that far, and
Yeah, setback.
I
The setback. Yeah.
and I kind of felt like it was, back to square one. I've got to do this all over again. And yeah, little did I know that if I was going to have a recurrence, that was probably the best case scenario for me. We did another PET scan. It hadn't spread anywhere else. It was now like contained to the upper stomach. Um, so this would have been probably, yeah, February or March of 2020, right
Mm-hmm.
when COVID was just getting going.
Right.
Um, I
It's a hell of a time to have to
yeah,
make that decision to,
mhm,
switch gears.
yeah. So I had a choice at that point to do um, chemotherapy and proton radiation, or to just do more chemotherapy. And again, there was no, my guess was as good as the doctor's as far as what to do.
Right.
Um, so I chose to do more chemotherapy, 4 more treatments,
Mm-hmm.
just so it had spread, and that was back to the heavier, hard-hitting stuff. Now it was different than the stuff I took before. I had an allergic reaction to that, so they had to give me something different. But this stuff, I didn't tolerate it well. It was a lot more brutal.
Wow.
Yeah. Um, I would say between my treatments, these were every 2 weeks as well. I still probably got maybe 8 good days in between, but it was
Mm-hmm.
rough.
Right.
Um, so one more, PET scan after this chemotherapy, and I was noticing a little bit of improvement, but I could tell that whatever was there was still there. And yeah, the PET scan basically showed that there was a lot of improvement, but
Mm.
there was definitely still a tumor there.
Wow.
Um, and that's when I really finally started dealing with radiation oncology. Um, and essentially, I made the decision in June of 2020 to do, it was a month of proton radiation combined with Taxol Taxol chemotherapy. That's carboplatin and paclitaxel.
Mm-hmm.
Um, it's a weekly, one day a week, and the radiation was 5 days a week.
Wow.
And the radiation, it was the entire esophagus, upper stomach, and every single lymph node that they knew was infected before also
Wow.
had to get hit. So
Wow.
it was an extremely like wide field.
Wow.
And throughout all of it, even after the surgery now, throughout all of it, that was probably the worst month of my life. Um,
Wow.
I think I threw up probably more than I ate, and
Were you losing a significant? I mean, you had to have lost a significant amount of weight. It had to be.
I I I really started to at that point. I really maintained weight pretty well until I started going through that. Um,
Mhm.
I never got sickly skinny, but yeah, that was not,
Mm,
it was not for me.
right.
Um, so after this, after the chemo radiation, there's about a 4 month waiting, or not 4 months, 4 weeks waiting period.
Mm-hmm.
Uh, we did another PET scan, and I sat down with my surgeon, kind of went over this and went over the results, and he basically told me, um, if you want a shot at a cure, you know, this is your shot within these next 2 months.
Wow.
He said there's there's a good chance that tumor is not gone. Like he couldn't tell from the scan whether it was gone or not. Like they could tell it had shrunk,
Right.
but that's the thing with CT scans and PET scans, they can miss things.
Right.
So he basically told me where that tumor is growing. Um, he said it. He said if he had to guess, it's probably still there. Um,
Mm,
no amount of modern treatment by itself is ever going to get rid of that. He's like, you might contain it for months or
mm-hmm.
years, he said, but nothing we can throw at it anymore short of surgery is going to get rid of it.
Wow.
So, he didn't tell me what to do. He
Mm-hmm.
said, these next couple months, this is your shot.
Wow. That's a hard decision to make. It's
It it really is, and I had heard so many horror stories about this surgery, and I mean, I'm on a lot of these support groups on Facebook, and I mean, I've just,
mm-hmm.
witnessed some of the things people go through after it, and yeah, it
Absolutely.
was pretty terrifying.
Yes.
Um, I ultimately chose to do it, and I had a great surgeon.
That's great.
So the whole esophagus went bye-bye, and the top half of the stomach, and long story short, to break it down Barney style, they simply take what's left of the stomach, stretch it out,
They pull it
and
up. Right.
pull it up kind of close, kind of, I think, kind of right next to the heart, I think.
Mm.
Um,
It's it sounds to me like it would be one of the most hardest to recover from surgeries. I mean, simply because eating, drinking, everything. Just you're risking losing all of that when you had already been unable to operate, or function normally,
hmm
under the treatment, but the surgery itself. I mean, did you
hmm
feel confident in the outcome, in the results, and in actual
Um,
fighting it?
yeah, there was, as far as surviving the surgery, there was never a big concern about surviving it.
Right.
But I mean, there are a lot of things that can go wrong,
Of
but
course.
there's a lot of things that can go right too.
Mm-hmm.
Um, yeah, and there's a lot of things that have to change,
Mm-hmm.
um,
Right.
like that. Um, for example, I have to sleep elevated for the rest of my life, as in, my torso has to be elevated about 20
Right.
degrees
Well, that's what I was
because
going to
there's
say. So after your surgery did, or before, or I guess in that process, your entire quality of life changes. So I guess that's
it.
one thing people will probably ask: how does your quality of life change? Whether it's, as you're saying, just your day-to-day operation, the food you eat, just how did your quality of life change? And did it even get better in any way? Because now you at least it's there's one factor that
hmm
you don't have to deal with.
Um, I can say 18 months later now, it definitely got better.
Mm-hmm.
Even 5 months later, I will say it takes a lot of patience and a lot of time. Getting getting energy back and stamina back was a huge thing. Was a huge issue. Number
Mm-hmm.
one, the chemotherapy and radiation by itself puts your body through hell.
Right.
Um, the surgery, like you said, is one of the one of the worst ones that you can really do to your body as far as long-lasting trauma.
Right.
So you've got those two things combined. You know, for me, for me personally, that month of chemo radiation was, at least short term, was worse for me, harder for me to deal with.
Wow.
And
That's
I'm,
surprising, but like you said, and did your body handle the surgery well in terms of recovery? How long did it take you to recover? Even I mean, especially internally, you're saying physically you're still, you still get winded or the energy, but how about, just the I guess people who are hesitant about this, because there are so many people on social media and in these groups who, it's like you're just playing Russian roulette. You don't know. It could be better or it could not be better or it could be worse, So where do you see that kind of in your favor? Like I said, the better quality of life. Are you eating better? Or in addition to that, and now you can sort of have a better
Mhm.
quality of life.
um, how you eat afterwards definitely changes. I was, for 1 month after the surgery, I was on tube feeding only. Now that sounds probably, you know, like a horrible thing to go through for most people, but
Hmm.
um, that's for the least of your concerns.
Right,
Um,
of course.
it, what I want to say too with this surgery is, if someone decides to have it done, go to a facility that does hundreds or thousands of these a year, like
Do your
Mayo and,
research. Right.
yep, the Anderson Cleveland Clinic. Don't go to the Joe Schmo clinic down the street
Right.
that only does two or three of them
Right.
and has no clue how to deal with um, complications. I mean, the the only thing, I expected to be in so much pain after this surgery, and there really wasn't a lot of pain. That was kept well controlled.
Hmm.
It was more like stiffness and soreness.
Hmm.
They tell you to get moving and get walking as soon as you can after this surgery.
Hmm.
And that night, I was, I think, 3 or 4 hours later, up walking I think 2 times that night. Um,
Wow.
it's just to keep, you know, to keep those muscles from getting stiff
Right.
and, or worse than they already are going to be.
Hmm.
I will say this, that if you have problems before the surgery, they're going to probably be a little worse afterwards. Like, I already had issues with a little bit of back pain,
Hmm.
for probably 20 years already. Now that's a little bit worse,
Wow.
but the overall quality of life, I, in my case, it was worth it.
That's great. That's
Now,
great to hear. What's your message overall? This we're gonna wrap up in a little bit, but what's your overall message to those who have even early diagnosis? Your thoughts on how the medical system handles this particular cancer, and what can you impart on families who are dealing with this, who might not have somebody who wants to discuss it, but maybe they need the support.
I would say, number one, don't be afraid to reach out and ask questions.
Hmm.
For I think 7 or 8 months, I really didn't seek out any of these like groups on social media.
Hmm.
You know, me and my girlfriend at the time, we were kind of just in our own little world, and I did so well right off the bat that, like I said, it just kind of became this minor inconvenience for me personally. But, you know, I mean, I had some hiccups and problems along the way too.
Hmm.
There's 16, 17,000 people, I guess, in the U.S. every year going through this same thing. So
Hmm.
no
Speak up.
question is a
Yeah.
question.
Yeah,
Hmm.
be aggressive. I think the most important message that I get from all of the interviews I do is to be, be an advocate, be aggressive, and because the medical system just, unfortunately, any medical experts who wind up watching this, and I apologize, but they don't seem to accurately assess, a patient's drive for hope or what they're going through. I think getting this like a death sentence is almost one of the most disappointing aspects from what I've heard from survivors. So what do you think that doctors could do differently to give hope for this cancer?
Um, I really don't have a good answer for that.
I
One of
don't
the
either, but I know it's interesting to think, maybe care a little bit more. Don't be so quick to judge each patient. And I mean, from speaking to you, it just seems like, they shouldn't judge each patient on the broad spectrum of statistics, because it's just, people are fighters. There are people out there who will fight and they will survive, and you're courageous for going forward with it, I must say.
yeah, I'll say this. I think your attitude and your spirit from the start is going to go a long way.
Hmm.
You know, I guess it's okay to feel devastated and defeated at first, but um, you know, shake it off, put on your boxing gloves and fight like hell. I mean,
That's great. That's
mhm.
great. You're an inspiration. Thank you so much. Have anything else to add before we end this live? I just want to thank everybody for tuning in, or anybody who's going to watch. We're going to post this on YouTube as well. So, Billy, I'm going to give you a copy of the interview so you can have it for your archives. Any final words before we part off?
Nothing I can think of. If um, I'll say this, especially for guys, males, this is more common in males.
Absolutely.
This type of cancer. If your check engine light is on, don't ignore.
Absolutely, absolutely. Thank you so much, Billy. I appreciate your sharing your story. And I'm so glad we connected. I'm so glad that you shared your story with others. Hope this will save someone's life. This will give them some, some rays of hope. This will give them some guidance, some confidence, and maybe just some backing to make their own decisions for their own health. Because I said it's a lesser known cancer. It's severely underfunded. There's no mandated screenings. And I just think it's time for a change. So thank you so much. And, we'll keep in touch, and hopefully, you know, you're going to be telling the story again in years to come.
I really hope so. Yeah.
Great. Thank you so much. If you have any comments or any questions, you can drop it below. Billy will answer. And thank you so much. Have a
Thank
great
you.
night. It was great speaking with you.
You too. Good night.
Thank you. Have a good night.
Yep. Bye.